Question 1. The analysis reveals a 68-year-old male with type 2 diabetes mellitus, hypertension, and a history of myocardial infarction presents for his annual physical. His current medications include metformin 1000 mg twice daily, lisinopril 20 mg daily, and aspirin 81 mg daily. His most recent HbA1c is 7.8%, and his estimated glomerular filtration rate, eGFR, is 45 ml/min/1, 73 m2. He reports occasional palpitations but denies chest pain or shortness of breath. Given his cardiovascular history and declining renal function, which of the following medication adjustments or additions would be most appropriate for optimizing his glycemic control and cardiovascular risk? Option A. Continue metformin at the current dose and monitor HbA1c. Option B. Continue metformin and add a sulfonylurea agent. Option C. Increase the dose of metformin and add an SGLT2 inhibitor. Option D. Discontinue metformin and initiate a GLP-1 receptor agonist. Correct answer is B. Continue metformin and add a sulfonylurea agent. Explanation. This scenario presents a common clinical challenge involving medication management for a patient with multiple comorbidities, requiring a nuanced understanding of pharmacodynamics and patient-specific factors. The professional challenge lies in balancing the need for glycemic control with the risk of adverse drug reactions and interactions, particularly in a patient with a history of cardiovascular disease. Careful judgment is required to select the most appropriate therapeutic agent that minimizes risk while maximizing efficacy, adhering to established clinical guidelines and the NCCPA scope of practice. The correct approach represents best professional practice because it prioritizes patient safety and evidence-based medicine. Selecting a medication with a favorable cardiovascular safety profile, such as a GLP-1 receptor agonist or an SGLT2 inhibitor, aligns with current guidelines for managing type 2 diabetes in patients with established atherosclerotic cardiovascular disease. These agents have demonstrated cardiovascular benefits beyond glycemic control, making them a preferred choice. This approach adheres to the NCCPA emphasis on providing high-quality, patient-centered care within the physician-assistant scope of practice, which includes comprehensive medication management and patient education. An incorrect approach of continuing metformin without considering the patient's worsening renal function and cardiovascular risk factors is professionally unacceptable. Metformin is contraindicated or requires dose adjustment in moderate to severe renal impairment due to the risk of lactic acidosis, a serious and potentially fatal adverse effect. Furthermore, while metformin is generally considered safe for cardiovascular health, it does not offer the specific cardiovascular benefits seen with newer agents in high-risk patients. This failure to adjust medication based on evolving patient status and contraindications violates the ethical principle of non-maleficence and the regulatory expectation of diligent patient monitoring and appropriate medication selection. Another incorrect approach of initiating a sulfonylurea agent without careful consideration of the patient's cardiovascular history and risk of hypoglycemia is also professionally unacceptable. Sulfonylureas, while effective at lowering blood glucose, are associated with an increased risk of hypoglycemia, particularly in elderly patients or those with comorbidities. They also lack the demonstrated cardiovascular benefits of other drug classes and may even be associated with increased cardiovascular risk in some studies. This choice disregards the patient's specific risk profile and the availability of safer, more beneficial alternatives, failing to meet the standard of care for managing diabetes in a patient with cardiovascular disease. A professional reasoning process for similar situations should involve a systematic evaluation of the patient's current clinical status, including comorbidities, laboratory values, and medication history. This should be followed by a thorough review of current evidence-based guidelines and drug information resources to identify therapeutic options that are both effective and safe for the individual patient. A shared decision-making process with the patient, discussing the risks and benefits of each treatment option, is also crucial. Finally, ongoing monitoring of the patient's response to therapy and for any adverse effects is essential to ensure optimal outcomes and adherence to professional standards. Question 2. The risk matrix shows a patient presenting with acute onset of pleuritic chest pain and dyspnea with a history of recent orthopedic surgery, Which of the following diagnostic pathways best aligns with the regulatory framework for physician assistant practice in assessing for a potential pulmonary embolism? Option A. Refer the patient directly to a cardiologist for further evaluation without initial diagnostic workup. Option B. Perform a chest X-ray and, if clear, discharge the patient with a prescription for pain medication. Option C. Order a D-dimer assay and, if positive, proceed to CT pulmonary angiography. If the D-dimer is negative and clinical suspicion remains low, consider alternative diagnoses. Option D. Initiate empiric anticoagulation therapy immediately given the patient's symptoms and recent surgery. The correct answer is C. Order a D-dimer assay and, if positive, proceed to CT pulmonary angiography. If the D-dimer is negative and clinical suspicion remains low, consider alternative diagnoses. Explanation. Scenario analysis. This scenario presents a professional challenge due to the potential for delayed diagnosis and treatment of a serious respiratory condition, specifically a pulmonary embolism, P. The patient's presentation with pleuritic chest pain and shortness of breath, coupled with risk factors like recent surgery, necessitates a prompt and accurate assessment. The challenge lies in balancing the need for urgent investigation with avoiding unnecessary or potentially harmful interventions, all while adhering to established clinical guidelines and the NCCPA scope of practice for PAs. Correct approach analysis. The correct approach involves a systematic and evidence-based evaluation of the patient's symptoms and risk factors. This includes a thorough history and physical examination, followed by the judicious use of diagnostic tools such as a D-dimer assay, and, if indicated, imaging studies like a CT pulmonary angiography. This approach aligns with NCCPA guidelines that emphasize the PA's role in patient assessment, diagnosis, and management within their supervised practice setting. It prioritizes patient safety by seeking to confirm or exclude a life-threatening condition efficiently and effectively, thereby representing best professional practice. Incorrect approach is analysis, an approach that solely relies on a chest X-ray without considering the patient's risk factors or other diagnostic modalities would be a regulatory and ethical failure. A chest X-ray is often normal in PE and may not provide sufficient information to rule out the diagnosis, leading to a delay in appropriate treatment. This demonstrates a failure to adhere to best practices in diagnostic workup as expected of a certified PA. Another incorrect approach would be to immediately initiate anticoagulation without a definitive diagnosis or a high clinical suspicion supported by objective data. While anticoagulation is the cornerstone of PE treatment, empirical treatment without proper diagnostic workup carries risks, including bleeding complications, and may not be justified based on the initial presentation. This could be considered a deviation from appropriate diagnostic and management protocols, potentially exceeding the PA's scope of practice if not adequately supervised or justified by clinical evidence. Finally, discharging the patient with symptomatic treatment for pleurisy without further investigation, despite the presence of risk factors for PE, would be a significant professional and ethical lapse. This failure to adequately assess and investigate a potentially life-threatening condition could lead to severe patient harm and represents a clear violation of the duty of care expected of a PA. Professional reasoning. Professionals should employ a diagnostic reasoning process that begins with a comprehensive assessment of the patient's chief complaint and associated symptoms. This is followed by a thorough review of the patient's medical history, including risk factors. Based on this initial assessment, a differential diagnosis is formulated, and appropriate diagnostic tests are ordered in a stepwise, evidence-based manner. The decision-making process should always prioritize patient safety and adhere to established clinical guidelines and the regulatory framework governing PA practice. When faced with uncertainty or complex presentations, consultation with a supervising physician is paramount. Question 3. Stakeholder feedback indicates a need to assess the physician assistant's ability to apply knowledge of respiratory system anatomy and physiology in a critical care setting. A 68-year-old male presents to the emergency department with sudden onset of severe shortness of breath, tachypnea, and decreased breath sounds on the right. His oxygen saturation is 88% on room air. He has a history of hypertension and a recent surgical procedure. Which of the following approaches best demonstrates the physician assistant's understanding of the underlying pathophysiology and guides appropriate initial management? Option A. Focus solely on the low oxygen saturation and administer intravenous diuretics to reduce potential pulmonary edema. Option B. Perform a thorough physical examination including auscultation of lung fields, palpation for tactile fremitus and percussion, while correlating these findings with the patient's history and vital signs to formulate a differential diagnosis. Option C. Immediately initiate high-flow oxygen therapy and administer a bronchodilator, assuming a diagnosis of asthma exacerbation. Option D. Administer a sedative to reduce the patient's anxiety and work of breathing without further diagnostic workup. The correct answer is C. Immediately initiate high-flow oxygen therapy and administer a bronchodilator, assuming a diagnosis of asthma exacerbation. Explanation. This scenario presents a professional challenge because it requires a physician assistant (PA) to interpret complex physiological data in the context of a patient's acute respiratory distress, while simultaneously adhering to established clinical guidelines and ensuring patient safety. The PA must not only possess a strong understanding of respiratory anatomy and physiology, but also apply this knowledge judiciously to guide immediate patient management. The impact assessment approach is crucial here to evaluate the potential consequences of different diagnostic and therapeutic decisions. The correct approach, which involves a systematic assessment of the patient's respiratory status, correlating physical exam findings with diagnostic data, and considering the underlying pathophysiology, represents best professional practice. This aligns with the NCCPA emphasis on the PA's role in patient assessment, diagnosis, and management, grounded in a comprehensive understanding of human anatomy and physiology. Specifically, it reflects the PA's responsibility to gather and interpret patient information, develop a differential diagnosis, and implement an appropriate treatment plan, all within the scope of practice and under the supervision of a physician as required by state regulations. This methodical approach ensures that interventions are evidence-based and tailored to the individual patient's needs, minimizing the risk of harm and optimizing outcomes. An incorrect approach would be to solely rely on a single diagnostic test without considering the broader clinical picture. For example, focusing exclusively on a low oxygen saturation reading without evaluating lung sounds, patient's work of breathing, or medical history could lead to a misdiagnosis or delayed treatment for a condition that is not primarily hypoxemic. This failure to integrate multiple data points violates the ethical principle of beneficence and could lead to patient harm, potentially constituting a breach of professional duty and regulatory oversight. Another incorrect approach might be to initiate aggressive treatment based on a presumptive diagnosis without adequate diagnostic confirmation, which could lead to iatrogenic complications or mask a more serious underlying pathology. This demonstrates a lack of due diligence and a disregard for the systematic diagnostic process expected of a PA, potentially violating guidelines related to prudent medical practice and patient safety. The professional reasoning process in such situations should involve a structured approach. 1. Recognize the acuity of the patient's condition and the need for prompt evaluation. 2. Gather comprehensive subjective and objective data, including a thorough respiratory assessment. 3. Utilize diagnostic tools judiciously, interpreting results in the context of the patient's presentation. 4. Formulate a differential diagnosis based on the integrated data and understanding of respiratory pathophysiology. 5. Develop and implement a treatment plan in collaboration with the supervising physician, continuously reassessing the patient's response. 6. Document all findings, assessments, and interventions meticulously. Question 4. During the evaluation of a 68-year-old male patient with a history of hypertension, atrial fibrillation, and hyperlipidemia, who presents for a routine follow-up, which of the following represents the most appropriate management approach regarding his antihypertensive, anticoagulant, and lipid-lowering medications? Option A. Prioritize the patient's request to discontinue his anticoagulant medication due to perceived side effects, despite his diagnosis of atrial fibrillation, without a thorough discussion of the risks and benefits. Option B. Conduct a comprehensive medication review, assess current symptoms and vital signs, review recent laboratory values, e.g., inner lipid panel, renal function, and select appropriate agents based on current clinical guidelines and potential drug interactions, followed by thorough patient education. Option C. Renew all existing prescriptions for antihypertensives, anticoagulants, and lipid-lowering agents without further assessment, assuming the current regimen is still optimal. Option D. Initiate a new, more potent antihypertensive medication immediately due to a single elevated blood pressure reading at this visit, without a full review of his current regimen or other contributing factors. The correct answer is B. Conduct a comprehensive medication review, assess current symptoms and vital signs, review recent laboratory values, e.g., inner, lipid panel, renal function, and select appropriate agents based on current clinical guidelines and potential drug interactions, followed by thorough patient education. Explanation. Scenario analysis. This scenario presents a common clinical challenge involving a patient with multiple cardiovascular risk factors requiring management with antihypertensives, anticoagulants, and lipid-lowering agents. The complexity arises from the potential for drug-drug interactions, the need to tailor therapy to individual patient characteristics and comorbidities, and the importance of patient education for adherence and monitoring. A physician assistant (PA) must integrate knowledge of pharmacology, patient history, and current guidelines to make safe and effective treatment decisions. Correct approach analysis. The correct approach involves a comprehensive assessment of the patient's current medications, allergies, comorbidities, and lifestyle factors. This includes reviewing recent laboratory values, e.g., INR for anticoagulation, lipid panel, renal function, and considering the patient's adherence to previous regimens. Based on this thorough evaluation, the PA would then select appropriate agents, considering evidence-based guidelines for hypertension, anticoagulation, and dyslipidemia, while actively screening for and mitigating potential drug interactions. Patient education on medication purpose, side effects, and monitoring is paramount for successful management and adherence, aligning with the PA's ethical and professional responsibility to provide patient-centered care, as outlined by the NCCPA focus on clinical competence and patient safety. Incorrect approach is analysis. One incorrect approach would be to simply renew existing prescriptions without a thorough reassessment of the patient's current clinical status, laboratory values, or potential for drug interactions. This fails to uphold the professional standard of care, as patient needs and responses to medication can change over time. Ethically, it could be considered negligent if a change in condition or a new interaction is missed, potentially leading to adverse events. This approach also disregards the NCCPA emphasis on ongoing assessment and evidence-based practice. Another incorrect approach would be to initiate new medications based solely on a single elevated lab value without considering the broader clinical picture or alternative management strategies. For example, starting a potent antihypertensive without assessing for secondary causes of hypertension or considering lifestyle modifications first could lead to overtreatment and adverse effects. This demonstrates a lack of critical thinking and a failure to adhere to a systematic approach to patient care, which is a core competency for PAs. A third incorrect approach would be to prioritize patient preference over established clinical guidelines without a clear, evidence-based rationale. While patient autonomy is important, a PA must guide treatment decisions based on what is medically sound and safe, ignoring established protocols for managing hypertension, anticoagulation, or dyslipidemia in favor of unproven or potentially harmful patient requests would be a significant ethical and professional failing, potentially jeopardizing patient well-being and violating the principles of responsible medical practice. Professional reasoning. Professionals should employ a systematic decision-making framework that begins with a thorough patient history and physical examination. This is followed by a review of all relevant diagnostic data, including laboratory results and imaging. Next, the PA should consult current, evidence-based clinical practice guidelines for the conditions being managed. Potential drug-drug interactions and contraindications must be carefully evaluated using reliable resources. Finally, the treatment plan should be individualized to the patient's specific needs, preferences, and ability to adhere, with clear patient education and a plan for follow-up and monitoring. Question 5. The monitoring system demonstrates that a 55-year-old male with a history of Crohn's disease, managed with mesalamine, presents with new onset of epigastric pain, occasional nausea, and a subjective feeling of a lump in his throat, particularly after meals. He denies any recent changes in his bowel habits or blood in his stool. He reports occasional heartburn that he has been self-treating with over-the-counter antacids with partial relief. Which of the following diagnostic and management approaches best reflects appropriate initial care for this patient? Option A. Advise the patient to avoid trigger foods and recommend lifestyle modifications for GERD, deferring further diagnostic testing unless symptoms worsen significantly. Option B. Order a comprehensive metabolic panel, CMP, including liver function tests and abdominal ultrasound, and schedule an upper endoscopy to evaluate for GERD, peptic ulcer disease, and potential complications of his Crohn's disease. Option C. Initiate a trial of a proton pump inhibitor, PPI, for suspected GERD and schedule a follow-up appointment in 2 weeks to assess symptom response. Option D. Refer the patient directly to a gastroenterologist for immediate evaluation of his Crohn's disease exacerbation and potential complications. Correct answer is C. Initiate a trial of a proton pump inhibitor, PPI, for suspected GERD and schedule a follow-up appointment in 2 weeks to assess symptom response. Explanation. Scenario analysis. This scenario presents a common clinical challenge where a patient with a known chronic gastrointestinal condition, inflammatory bowel disease (IBD), exhibits new symptoms that could be related to their underlying disease or a separate, emergent issue. The professional's responsibility is to differentiate between exacerbation of IBD, a complication of IBD, or an entirely unrelated gastrointestinal problem, such as GERD or liver disease, given the patient's history and new findings. This requires a thorough assessment, understanding of differential diagnoses, and appropriate diagnostic workup, all while adhering to the NCCPA scope of practice and ethical guidelines for physician assistants. Correct approach analysis. The correct approach involves a comprehensive patient assessment that includes a detailed history of present illness, review of systems, past medical history, specifically focusing on IBD management and previous complications, physical examination, and consideration of relevant laboratory and imaging studies. This systematic approach aligns with the NCCPA emphasis on evidence-based practice and the PA's role in diagnosing and managing conditions within their scope. By considering the patient's IBD history and evaluating for signs and symptoms suggestive of GERD or liver disease, the PA is demonstrating appropriate clinical reasoning and a commitment to providing patient-centered care. This includes ordering appropriate diagnostic tests to confirm or rule out specific conditions, which is a core competency for PAs. Incorrect approach is analysis. One incorrect approach would be to solely attribute the new symptoms to a GERD exacerbation without a thorough evaluation, especially given the history of IBD. This fails to consider the potential for IBD complications or other coexisting conditions, potentially delaying critical diagnosis and treatment. This represents a failure to adhere to the principle of comprehensive patient assessment and could lead to suboptimal patient outcomes, a violation of ethical practice. Another incorrect approach would be to immediately escalate care to a specialist without performing an initial workup. While collaboration with specialists is crucial, PAs are trained to perform initial assessments and diagnostic evaluations for common gastrointestinal diseases. Premature referral without adequate information gathering can be inefficient and may not be the most appropriate use of healthcare resources, potentially deviating from the PA's established scope of practice for initial management. A third incorrect approach would be to dismiss the symptoms as non-significant without adequate investigation, particularly if the patient has a history of IBD. This oversight could lead to misdiagnoses of serious complications or coexisting conditions, directly impacting patient safety and well-being. This demonstrates a lack of diligence and adherence to the standard of care expected of a PA. Professional reasoning. Professionals should approach such scenarios by first activating their clinical reasoning framework. This involves gathering all available data, patient history, physical exam, prior records, formulating a differential diagnosis based on the presenting symptoms and patient's medical history, and then devising a diagnostic and management plan. This plan should prioritize ruling out the most serious conditions first, followed by less emergent possibilities. The PA should continuously reassess the patient's condition and adjust the plan as new information becomes available. Collaboration with supervising physicians and specialists is an integral part of this process when indicated, ensuring the highest quality of care within the PA's scope of practice and regulatory guidelines. Question 6. The efficiency study reveals that the average patient encounter time for a physician assistant in a busy primary care clinic is 15 minutes. A patient presents with a constellation of symptoms that, based on initial assessment, may require a more in-depth history, physical examination, and potentially further diagnostic workup than can typically be completed within this time frame. What is the physician assistant's primary responsibility in this situation? Option A, to limit the patient encounter to 15 minutes, focusing only on the most critical symptoms and deferring further evaluation to a follow-up appointment. Option B, to delegate the majority of the patient's history taking and physical examination to a medical assistant to expedite the process within the 15-minute time frame. Option C, to immediately refer the patient to a specialist without performing an initial assessment, to ensure the patient is seen within the clinic's efficiency targets. Option D, to conduct a thorough patient assessment, including a comprehensive history, physical examination, and appropriate diagnostic testing, even if it exceeds the average encounter time, and to communicate any necessary adjustments to the schedule or seek assistance if needed. The correct answer is D, to conduct a thorough patient assessment, including a comprehensive history, physical examination, and appropriate diagnostic testing, even if it exceeds the average encounter time, and to communicate any necessary adjustments to the schedule or seek assistance if needed. Explanation. Scenario analysis. This scenario presents a common challenge in clinical medicine where a physician assistant (PA) must balance the need for efficient patient care with the imperative of providing thorough and accurate diagnostic evaluations. The pressure to reduce patient wait times, as indicated by the efficiency study, can inadvertently lead to shortcuts that compromise the quality of care and potentially violate regulatory standards for patient assessment. The PA must exercise sound clinical judgment to ensure that efficiency measures do not detract from the fundamental duty of care. Correct approach analysis. The correct approach prioritizes a comprehensive patient assessment, including a detailed history, physical examination, and appropriate diagnostic testing, even if it extends beyond the average time allocated. This aligns with the NCCPA emphasis on the PA's responsibility to provide high-quality medical care within their scope of practice. Regulatory frameworks, such as those governing PA Practice Acts and professional standards, mandate that PAs conduct thorough evaluations to ensure accurate diagnoses and effective treatment plans. Deviating from this standard, even for efficiency, could be considered a breach of professional duty and potentially violate regulations requiring appropriate patient assessment. Incorrect approaches analysis. One incorrect approach involves relying solely on a brief history and physical examination, omitting further diagnostic steps due to time constraints. This fails to meet the regulatory requirement for a comprehensive patient assessment, potentially leading to misdiagnosis or delayed treatment, which is a violation of the standard of care and professional responsibility. Another incorrect approach is to delegate the full diagnostic workup to another healthcare professional without direct oversight or personal involvement in the initial assessment. While collaboration is encouraged, the PA retains ultimate responsibility for the patient's care within their scope. This abdication of responsibility can violate regulations that define the PA's role in patient management and assessment. A third incorrect approach is to dismiss the patient's symptoms as minor without adequate investigation, based on the assumption that the efficiency study's targets imply less complex cases. This demonstrates a failure in clinical judgment and a disregard for the potential seriousness of presenting symptoms, violating the ethical and regulatory obligation to thoroughly evaluate all patients. Professional reasoning. Professionals facing such a dilemma should employ a decision-making process that begins with reaffirming their primary ethical and regulatory obligation to patient well-being. This involves prioritizing a thorough clinical assessment over arbitrary time targets. If efficiency targets are genuinely hindering adequate care, the professional should advocate for a review of those targets with their supervising physician or practice administrator, providing evidence of how the current targets compromise patient safety and quality of care. This proactive communication and advocacy for patient-centered care are crucial for maintaining professional integrity and ensuring compliance with regulatory standards. Question 7. Regulatory review indicates a physician assistant is evaluating a patient presenting with new onset shortness of breath and cough, which upon further workup is diagnosed as an acute exacerbation of newly identified chronic obstructive pulmonary disease, COPD. Which of the following approaches best aligns with current best practices for managing this patient? Option A. Base the treatment plan for both the acute exacerbation and the chronic COPD on the patient's description of what has worked for similar symptoms in the past, without consulting established clinical guidelines. Option B. Initiate treatment for the acute exacerbation with bronchodilators and corticosteroids, and concurrently develop a comprehensive, long-term management plan for COPD, including patient education, smoking cessation counseling, and appropriate inhaler therapy. Option C. Focus solely on managing the acute symptoms of shortness of breath and cough, deferring any discussion or planning for the newly diagnosed COPD until the acute episode has fully resolved. Option D. Immediately prescribe long-acting bronchodilators and inhaled corticosteroids for the COPD, and advise the patient to manage their acute symptoms of shortness of breath and cough as they arise. The correct answer is B. Initiate treatment for the acute exacerbation with bronchodilators and corticosteroids, and concurrently develop a comprehensive, long-term management plan for COPD, including patient education, smoking cessation counseling, and appropriate inhaler therapy. Explanation. Scenario analysis. This scenario presents a common challenge in primary care, managing a patient with a newly diagnosed chronic condition alongside an acute exacerbation. The professional challenge lies in balancing immediate symptom relief with long-term disease management, ensuring patient safety, adherence, and appropriate resource utilization. The PA must integrate current best practices with established guidelines for both conditions, while also considering the patient's individual circumstances, comorbidities, and preferences. This requires a comprehensive assessment, clear communication, and a well-defined treatment plan that addresses both the acute and chronic aspects of the patient's health. Correct approach analysis. The correct approach emphasizes a holistic and evidence-based strategy. It involves a thorough assessment to confirm the diagnosis of the chronic condition and evaluate the severity of the acute exacerbation. This is followed by initiating evidence-based treatment for the acute symptoms, while simultaneously developing a comprehensive, long-term management plan for the chronic condition. This plan should incorporate patient education, lifestyle modifications, appropriate pharmacotherapy, and a clear follow-up schedule. This approach aligns with NCCPA emphasis on the PA's role in managing patients across the continuum of care, adhering to established medical guidelines, and promoting patient-centered outcomes. It reflects best professional practice by addressing both immediate needs and future health, fostering patient engagement, and ensuring continuity of care. Incorrect approach is analysis. Focusing solely on the acute exacerbation without addressing the underlying chronic condition represents a failure to provide comprehensive care. This approach neglects the long-term health implications for the patient and may lead to recurrent acute episodes, disease progression, and poorer overall outcomes. Ethically, it falls short of the duty to provide thorough and ongoing care. Prioritizing the chronic condition management to the exclusion of the acute symptoms would be detrimental to the patient's immediate well-being and could lead to significant discomfort, functional impairment, or even serious complications from the acute exacerbation. This demonstrates a lack of clinical judgment in prioritizing patient needs. Adopting a treatment plan based on anecdotal evidence or personal preference rather than established clinical guidelines and best practices is a significant regulatory and ethical failure. It compromises patient safety, can lead to ineffective or harmful treatments, and deviates from the professional standards expected of PAs. This approach undermines the evidence-based foundation of modern medicine and the PA's responsibility to practice within their scope and according to accepted medical standards. Professional reasoning. Professionals should approach such situations by first performing a thorough differential diagnosis for the acute symptoms, then confirming the new chronic diagnosis. This is followed by a systematic review of current, evidence-based guidelines for both the acute exacerbation and the newly diagnosed chronic condition. The PA should then assess the patient's individual factors, including comorbidities, social determinants of health, and personal preferences, to tailor a treatment plan. This plan should be clearly communicated to the patient, with emphasis on education regarding both conditions and the rationale for the chosen interventions. Establishing a clear follow-up strategy to monitor progress, adjust treatment, and reinforce education is crucial for optimal patient outcomes and adherence. Question 8. The performance metrics show a higher than average rate of readmission for patients diagnosed with peptic ulcer disease who present with acute gastrointestinal bleeding. As a physician assistant working in a busy gastroenterology clinic, what is the most appropriate initial step to address this trend, considering the need for timely and effective patient management? Option A. Advise patients with a history of peptic ulcer disease to avoid all acidic foods and beverages indefinitely, as a preventative measure against future bleeding episodes. Option B. Implement a new experimental treatment protocol for all patients presenting with GI bleeding, based on recent literature, without prior consultation or approval from the supervising physician. Option C. Review the practice's current protocols for managing acute GI bleeding in patients with peptic ulcer disease, focusing on diagnostic workup, medication management, and criteria for inpatient admission, and discuss any identified gaps or areas for improvement with the supervising physician. Option D. Delay reporting the performance metric trend to the supervising physician until a comprehensive, multi-year data analysis can be completed to ensure the trend is statistically significant. The correct answer is C. Review the practice's current protocols for managing acute GI bleeding in patients with peptic ulcer disease, focusing on diagnostic workup, medication management, and criteria for inpatient admission, and discuss any identified gaps or areas for improvement with the supervising physician. Explanation: the performance metrics show a concerning trend in the management of gastrointestinal GI bleeding within the physician-assistant PA practice. This scenario is professionally challenging because it requires the PA to balance immediate patient needs with established protocols, physician oversight, and the ethical imperative to provide evidence-based care. The complexity arises from the potential for rapid patient deterioration, the need for accurate diagnostic interpretation, and the coordination of care among multiple healthcare providers. Careful judgment is required to ensure patient safety, optimize resource utilization, and maintain professional standards. The correct approach represents best professional practice because it prioritizes patient safety and adherence to established clinical guidelines and the PA's scope of practice as defined by the NCCPA and state regulations. This involves a systematic assessment, prompt communication with the supervising physician, and the initiation of appropriate diagnostic and therapeutic interventions based on the patient's condition and the practice's protocols. This aligns with the ethical principles of beneficence and non-maleficence, ensuring the patient receives timely and effective care while minimizing risks. It also reflects the collaborative nature of PA practice, emphasizing the importance of physician-physician assistant team communication. An incorrect approach that involves delaying physician notification until a definitive diagnosis is made is a significant regulatory and ethical failure. This delays critical management decisions and potentially exposes the patient to harm due to delayed intervention, violates the principle of physician supervision, as the PA is expected to consult with their supervising physician in a timely manner for significant clinical changes or complex cases. Furthermore, it could be considered a breach of the standard of care, as prompt physician involvement is crucial in managing potentially life-threatening conditions like GI bleeding. Another incorrect approach, such as independently initiating aggressive, unproven treatments without physician consultation, represents a failure to adhere to the PA's scope of practice and established clinical protocols. This could lead to patient harm through inappropriate or excessive interventions and is a direct violation of the supervisory relationship. It demonstrates a lack of professional judgment and in disregard for the established framework of PA practice, which emphasizes collaboration and adherence to evidence-based medicine. The professional reasoning process for similar situations should involve a rapid assessment of the patient's stability, a clear understanding of the practice's established protocols for GI bleeding, and immediate communication with the supervising physician. The PA should be prepared to present a concise summary of the patient's history, physical findings, and initial assessment to facilitate prompt decision-making. This iterative process of assessment, communication, and intervention, guided by established standards and physician collaboration, is fundamental to effective and ethical patient care. Question 9. Benchmark analysis indicates that a 55-year-old patient presents with a 2-month history of progressive dyspnea on exertion, a non-productive cough, and occasional wheezing. The patient denies fever, hemoptysis, or chest pain. The physician assistant is considering initial diagnostic testing to evaluate the underlying cause of these symptoms. Which of the following diagnostic approaches best aligns with current best practices for physician assistant management in this scenario? Option A. Order spirometry to assess pulmonary function and evaluate for obstructive or restrictive lung disease. Option B. Obtain a CT scan of the chest to comprehensively visualize lung parenchyma and airways. Option C. Perform a chest X-ray to rule out significant infiltrates or masses. Option D. Order spirometry, a chest X-ray, and a CT scan of the chest concurrently to expedite diagnosis. The correct answer is A. Order spirometry to assess pulmonary function and evaluate for obstructive or restrictive lung disease. Explanation. This scenario presents a common clinical challenge where a physician assistant, PA, must judiciously select diagnostic tests to evaluate a patient's respiratory symptoms, balancing diagnostic accuracy with resource utilization and patient well-being. The challenge lies in understanding the specific indications, limitations, and comparative value of spirometry, chest X-ray, and CT scan in different clinical contexts, all while adhering to the NCCPA emphasis on evidence-based practice and appropriate patient care. The correct approach represents best professional practice by prioritizing a stepwise diagnostic strategy that begins with the least invasive and most cost-effective test indicated by the patient's presentation. Spirometry is the gold standard for assessing pulmonary function and diagnosing obstructive or restrictive lung diseases, making it the logical initial choice for evaluating symptoms suggestive of these conditions. This aligns with NCCPA guidelines that emphasize the PA's role in judicious test selection and management, ensuring that diagnostic efforts are targeted and efficient. An incorrect approach would be to order a CT scan as the initial diagnostic modality without clear indications. This fails to adhere to best practices by bypassing less invasive and more appropriate initial tests, leading to unnecessary radiation exposure, increased cost, and potential for incidental findings that may not be clinically relevant. Ethically and regulatorily, this represents a failure to practice cost-effectively and to minimize patient harm, which are core tenets of PA practice as outlined by the NCCPA. Another incorrect approach would be to solely rely on a chest X-ray for diagnosing functional lung disease. While a chest X-ray can identify structural abnormalities, it is not sensitive or specific for functional impairments like asthma or COPD, making it an incomplete diagnostic tool for the described symptoms, and thus a failure to employ the most appropriate diagnostic test. Finally, ordering all three tests simultaneously without a clear diagnostic rationale is inefficient and potentially wasteful, violating principles of responsible resource management and patient-centered care. Professional decision-making in such situations requires a systematic approach. First, thoroughly assess the patient's history and physical examination findings to formulate a differential diagnosis. Second, consider the diagnostic yield and invasiveness of available tests in relation to the suspected conditions. Third, consult evidence-based guidelines and literature to inform test selection. Finally, communicate the rationale for the chosen diagnostic plan to the patient and collaborate with supervising physicians when necessary. Question 10. Implementation of a risk assessment strategy for a patient presenting with a single, borderline elevated fasting blood glucose reading, where the PA must decide on the next diagnostic steps. Option A. Advise the patient to significantly restrict all carbohydrate intake and retest in 6 months without further immediate diagnostic evaluation. Option B. Correlate the blood glucose reading with the patient's recent dietary intake, activity level, and any reported symptoms of hyperglycemia or hypoglycemia, and consider repeating the test under standardized conditions if indicated. Option C. Order a comprehensive panel of endocrine function tests, including thyroid, adrenal, and pituitary hormones, to identify any underlying systemic cause for the elevated glucose. Option D. Immediately initiate a prescription for oral hypoglycemic agents to proactively manage the elevated glucose level. The correct answer is B. Correlate the blood glucose reading with the patient's recent dietary intake, activity level, and any reported symptoms of hyperglycemia or hypoglycemia, and consider repeating the test under standardized conditions if indicated. Explanation. This scenario presents a professional challenge due to the inherent variability in diagnostic test results and the potential for misinterpretation, which can lead to suboptimal patient care. The PA must exercise sound clinical judgment, considering the patient's overall clinical picture, not just isolated test values. The risk assessment involves evaluating the likelihood of a true abnormality versus a transient fluctuation or artifact, and the potential consequences of both over- and undertreatment. The correct approach represents best professional practice because it prioritizes a comprehensive, patient-centered assessment. This involves correlating diagnostic test results with the patient's history, physical examination findings, and other relevant clinical data. This holistic approach aligns with the NCCPA emphasis on evidence-based practice and the PA's responsibility to provide safe and effective patient care. It also reflects the ethical obligation to avoid unnecessary interventions and to ensure that diagnostic and therapeutic decisions are well supported by clinical evidence. An incorrect approach that relies solely on a single elevated blood glucose reading without further investigation fails to account for physiological variations and potential confounding factors, such as recent food intake or stress. This could lead to an unnecessary diagnosis of diabetes or prediabetes, resulting in patient anxiety, further testing, and potentially inappropriate medication. This approach violates the principle of thoroughness in diagnosis and could be considered a failure to practice with due diligence, as mandated by professional standards. Another incorrect approach that focuses on ordering a broad panel of hormone levels without a specific clinical indication is inefficient and potentially costly. It also risks generating incidental findings that may not be clinically significant, leading to further diagnostic uncertainty and patient distress. This approach deviates from the principle of judicious use of diagnostic resources and could be seen as a departure from evidence-based practice, as it lacks a clear rationale tied to the patient's presenting symptoms or risk factors. The professional decision-making process for similar situations should involve a systematic approach. 1. Gather comprehensive patient information, history, physical exam, current medications, lifestyle. 2. Formulate a differential diagnosis based on the presenting complaint and initial findings. 3. Select diagnostic tests that are most likely to confirm or refute specific diagnoses, considering their sensitivity, specificity, and clinical utility. 4. Interpret test results in the context of the entire clinical picture, not in isolation. 5. Reassess the differential diagnosis and develop a management plan that is tailored to the individual patient's needs and risks, with clear communication and patient education. Question 11. Governance review demonstrates a need to enhance the physician assistance approach to patients presenting with potential common neurological disorders. Considering the NCCPA emphasis on comprehensive patient assessment and management, which of the following approaches best reflects a risk assessment-driven strategy for a patient presenting with new-onset neurological symptoms? Option A. Refer the patient directly to a neurologist without performing an initial assessment or risk stratification. Option B. Focus solely on educating the patient about general neurological health and lifestyle modifications. Option C. Initiate a detailed neurological examination, review relevant diagnostic imaging and laboratory results, and formulate a differential diagnosis to guide further investigation and management. Option D. Immediately prescribe symptomatic relief for the patient's reported symptoms and schedule a follow-up appointment in several weeks. The correct answer is C. Initiate a detailed neurological examination, review relevant diagnostic imaging and laboratory results, and formulate a differential diagnosis to guide further investigation and management. Explanation. This scenario presents a professional challenge due to the inherent complexity of managing patients with common neurological disorders, where diagnostic uncertainty, evolving disease trajectories, and the need for multidisciplinary care are paramount. The physician assistant PA must balance immediate patient needs with long-term management strategies, adhering to established clinical guidelines and ethical principles. Careful judgment is required to ensure patient safety, optimize outcomes, and maintain professional accountability within the scope of practice as defined by the National Commission on Certification of Physician Assistants, NCCPA standards. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based risk assessment that directly informs the diagnostic and management plan. This aligns with NCCPA emphasis on the PA's role in patient assessment, diagnosis, and management. By systematically evaluating the patient's history, neurological examination findings, and relevant diagnostic studies, the PA can accurately stratify risk, identify potential red flags, and develop a tailored plan that addresses the specific neurological disorder. This approach ensures that interventions are appropriate, timely, and aligned with the patient's clinical presentation and prognosis, thereby upholding the ethical obligation to provide competent and patient-centered care. An incorrect approach that relies solely on symptom management without a thorough diagnostic workup fails to meet the fundamental requirements of accurate diagnosis and appropriate treatment planning, which are core competencies for PAs. This could lead to delayed or incorrect diagnoses, potentially exacerbating the underlying condition and negatively impacting patient outcomes, representing a failure to adhere to professional standards of care. Another incorrect approach that involves deferring all complex neurological cases to a specialist without attempting an initial assessment and risk stratification overlooks the PA's integral role in the healthcare team. While collaboration is essential, the PA is trained to manage a broad spectrum of conditions, including common neurological disorders. Failing to engage in initial assessment and risk assessment can lead to unnecessary delays in care and inefficient use of healthcare resources, potentially violating the principle of providing timely and accessible care. A third incorrect approach that focuses on patient education alone, without a clear diagnostic or management plan, is insufficient. While patient education is a crucial component of care, it must be grounded in a solid understanding of the patient's condition and a defined strategy for addressing it. Without this foundation, education may be misdirected or incomplete, failing to empower the patient effectively and address the underlying medical issue. The professional decision-making process for similar situations should involve a systematic approach. 1. Gather comprehensive patient information, history, symptoms, risk factors. 2. Conduct a thorough physical and neurological examination. 3. Formulate a differential diagnosis. 4. Identify key diagnostic and prognostic indicators to stratify risk. 5. Develop an evidence-based diagnostic and management plan, including appropriate consultations and follow-up. 5. Continuously reassess the patient's condition and adjust the plan as needed. This iterative process ensures that care is dynamic, responsive, and aligned with best practices and regulatory expectations. Question 12. Quality control measures reveal that a physician assistant has been managing a patient with a history of complex partial seizures and chronic neuropathic pain. The patient is currently prescribed a benzodiazepine for seizure control and gabapentin for pain. The physician assistant is considering adding a new agent to augment the patient's pain management, noting that the patient reports only partial relief. The physician assistant is evaluating several options for this addition. Which of the following approaches best reflects current best practices for managing this patient's pharmacotherapy, considering the need for effective pain relief while minimizing risks associated with polypharmacy and potential drug interactions? Option A. Prescribe a new analgesic agent based on the patient's report of partial relief, without a comprehensive review of the patient's current medication regimen or consultation with the supervising physician. Option B. Recommend the patient discontinue the benzodiazepine, as it may contribute to central nervous system depression and potentially mask pain symptoms, and then reassess pain management. Option C. Increase the dosage of the existing gabapentin to the maximum recommended dose, as this is a common strategy for neuropathic pain, without further investigation into the cause of partial relief. Option D. Initiate a trial of a novel adjunctive analgesic. After a thorough review of the patient's current medications for potential interactions, assessment of the patient's renal and hepatic function, and consultation with the supervising physician to discuss the rationale and monitoring plan. The correct answer is A. Prescribe a new analgesic agent based on the patient's report of partial relief, without a comprehensive review of the patient's current medication regimen or consultation with the supervising physician. Explanation. This scenario presents a professional challenge due to the critical nature of managing patients with neurological conditions requiring anticonvulsant, analgesic, and neuroprotective agents. The physician assistant PA must navigate complex pharmacotherapy, potential drug interactions, patient-specific factors, and the evolving understanding of these medications, all while adhering to the NCCPA scope of practice and relevant state regulations governing PA practice. The core of the challenge lies in ensuring patient safety and optimal therapeutic outcomes through evidence-based prescribing and vigilant monitoring. The correct approach represents best professional practice because it prioritizes a comprehensive, patient-centered assessment that integrates current evidence-based guidelines with individual patient needs. This involves a thorough review of the patient's medical history, current medications, comorbidities, and potential contraindications or precautions. It also necessitates understanding the pharmacokinetics and pharmacodynamics of the prescribed agents, anticipating potential adverse effects, and establishing a clear monitoring plan. This aligns with the NCCPA emphasis on competent and ethical practice, ensuring that PAs provide high-quality care within their defined scope. Adherence to established protocols and consultation with supervising physicians when necessary further reinforces this best practice. An incorrect approach that involves solely relying on a patient's previous prescription without reassessment fails to account for changes in the patient's condition, potential drug interactions that may have emerged, or the availability of newer, more effective, or safer alternatives. This could lead to suboptimal treatment, increased risk of adverse events, and a violation of the ethical duty to provide appropriate care. Another incorrect approach, such as prescribing based on anecdotal evidence or personal preference without consulting current literature or guidelines, disregards the evidence-based foundation of modern medicine and the responsibility to provide care that is supported by scientific consensus. This can result in ineffective treatment or unnecessary harm. A third incorrect approach, neglecting to establish a monitoring plan for potential side effects or therapeutic efficacy, leaves the patient vulnerable to complications and missed opportunities for dose adjustment or medication changes, thereby failing to meet the standard of care. Professional decision-making in such situations should involve a systematic process. 1. Patient assessment. Gather comprehensive patient data. 2. Evidence review. Consult current clinical practice guidelines and peer-reviewed literature. 3. Risk-benefit analysis. Evaluate the potential benefits against the risks of proposed pharmacotherapy. 4. Individualization. Tailor the treatment plan to the specific patient. 5. Monitoring and evaluation. Establish a plan to track efficacy and safety. 6. Collaboration. Consult with supervising physicians or specialists as needed. Question 13. The efficiency study reveals that a physician assistant has reviewed a patient's recent laboratory results which show an A1C of 6.8%. The patient is asymptomatic and has no prior history of diabetes mellitus. What is the most appropriate next step for the physician assistant? Option A. Correlate the A1C result with the patient's signs, symptoms, and medical history, and consider further diagnostic testing or management as indicated. Option B. Immediately prescribe oral hypoglycemic agents to manage the elevated A1C. Option C. Refer the patient to an endocrinologist for immediate evaluation. Option D. Document the A1C as a laboratory error and disregard the finding. The correct answer is A. Correlate the A1C result with the patient's signs, symptoms, and medical history, and consider further diagnostic testing or management as indicated. Explanation. Scenario analysis. This scenario presents a common challenge in primary care where a physician assistant, PA, must interpret and act upon laboratory results that indicate a potential endocrine disorder. The challenge lies in differentiating between a transient, clinically insignificant finding and a condition requiring immediate intervention or further investigation, all while adhering to established clinical guidelines in the scope of practice. The PA must consider the patient's overall clinical picture, not just isolated lab values, to ensure appropriate and timely management. Correct approach analysis. The correct approach involves correlating the laboratory findings with the patient's signs, symptoms, and medical history. This aligns with the NCCPA emphasis on evidence-based practice and the PA's role in comprehensive patient assessment. By considering the full clinical context, the PA can accurately diagnose or rule out a significant endocrine disorder, leading to appropriate management, which may include further testing, medication adjustment, or referral. This demonstrates adherence to the principles of patient-centered care and responsible clinical decision-making as expected of a certified PA. Incorrect approaches analysis. One incorrect approach would be to immediately initiate treatment based solely on an elevated A1C without considering other factors. This fails to adhere to diagnostic best practices, potentially leading to unnecessary medication, side effects, and patient anxiety. It bypasses the crucial step of confirming a diagnosis of diabetes mellitus through further evaluation, which is a fundamental aspect of responsible medical practice and could be considered a deviation from established diagnostic protocols. Another incorrect approach would be to dismiss the elevated A1C as a laboratory error without any further investigation or consideration of the patient's symptoms. This could lead to a misdiagnosis of a serious condition like diabetes mellitus, delaying necessary treatment and potentially resulting in long-term complications for the patient. This approach neglects the PA's duty to investigate abnormal findings thoroughly. A third incorrect approach would be to refer the patient to an endocrinologist solely based on the elevated A1C without performing any initial assessment or considering the possibility of other contributing factors or less severe conditions. While referral is sometimes appropriate and immediate, an investigated referral without the PA performing their due diligence in initial assessment and management can be inefficient and may not always be the most appropriate first step, potentially overburdening specialist resources and delaying patient care if the issue is manageable in primary care. Professional reasoning. When faced with abnormal laboratory results, a PA should employ a systematic approach. This involves 1. Reviewing the specific laboratory value in the context of the patient's presenting complaint, medical history, and current medications. 2. Consulting relevant clinical guidelines and evidence-based resources to understand the significance of the finding. 3. Determining if further diagnostic testing is warranted to confirm or refute a diagnosis. 4. Developing a management plan that may include initiating treatment, adjusting existing therapies, patient education, or referral to a specialist, always within the PA's scope of practice and in collaboration with a supervising physician when necessary. Question 14. Investigation of a 65-year-old male presenting with intermittent exertional dyspnea and occasional chest tightness with a history of hypertension and hyperlipidemia requires a systematic approach to cardiac evaluation. Which of the following diagnostic strategies best reflects appropriate initial management according to established guidelines for physician-assistant practice? Option A. Schedule an echocardiogram to evaluate cardiac structure and function. Option B. Order a complete cardiac panel including troponin and BNP. Option C. Initiate a stress test to assess for inducible ischemia. Option D. Obtain a 12-lead electrocardiogram, ECG, to assess for baseline electrical activity and potential ischemic changes. The correct answer is D. Obtain a 12-lead electrocardiogram, ECG, to assess for baseline electrical activity and potential ischemic changes. Explanation. This scenario presents a common clinical challenge where a physician-assistant PA must judiciously select diagnostic tests for a patient with concerning symptoms. The challenge lies in balancing the need for accurate diagnosis with resource utilization, patient comfort, and potential risks associated with invasive procedures. The PA must apply their knowledge of cardiovascular physiology and diagnostic test indications, guided by established clinical practice guidelines and the NCCPA scope of practice for PAs. The correct approach prioritizes a stepwise, evidence-based diagnostic strategy that begins with less invasive and more readily available tests, escalating as indicated by the patient's presentation and initial findings. This aligns with best professional practice by ensuring that diagnostic efforts are targeted and efficient, minimizing unnecessary costs and patient burden. Regulatory and ethical considerations mandate that PAs practice within their scope, provide evidence-based care, and act in the patient's best interest. An incorrect approach might involve ordering an echocardiogram or stress test without a clear indication based on the initial assessment or ECG findings. This would represent a failure to adhere to evidence-based practice guidelines, potentially leading to unnecessary healthcare expenditures and patient inconvenience. Ethically, it could be viewed as a failure to provide prudent and cost-effective care. Ordering only an ECG without further investigation when symptoms are suggestive of a more complex cardiac issue would also be an incorrect approach, as it fails to adequately investigate the patient's condition and could lead to a delayed or misdiagnosis, violating the ethical duty to provide appropriate care. The professional decision-making process should involve a thorough patient history and physical examination to identify risk factors and characterize symptoms. Based on this initial assessment, the PA should consider the most appropriate initial diagnostic test. If the ECG reveals abnormalities, or if the clinical suspicion remains high despite a normal ECG, then further investigation with an echocardiogram or stress test may be warranted, guided by specific indications for each modality. This iterative process ensures that diagnostic resources are used effectively and that the patient receives timely and accurate diagnosis and management. Question 15. What factors determine the optimal diagnostic and management pathway for a new, undiagnosed dermatologic lesion encountered by a physician assistant? Option A. The PA's personal preference for specific diagnostic tests regardless of the lesion's presentation. Option B. The lesion's morphology, patient's medical history, presence of systemic symptoms, and the PA's clinical expertise in dermatology. Option C. The patient's insurance coverage and the availability of immediate specialist appointments. Option D. The perceived urgency of the lesion based on a single visual characteristic and anecdotal patient reports. The correct answer is B. The lesion's morphology, patient's medical history, presence of systemic symptoms, and the PA's clinical expertise in dermatology. Explanation. The scenario of a physician assistant PA managing a patient with a new, undiagnosed dermatologic lesion presents a common yet professionally challenging situation. The challenge lies in the PA's responsibility to accurately assess, diagnose, and initiate appropriate management, all while operating within their scope of practice and adhering to established clinical guidelines and regulatory frameworks. This requires a systematic approach to information gathering and differential diagnosis, ensuring patient safety and optimal outcomes. The correct approach represents best professional practice because it prioritizes a thorough and systematic evaluation. This includes obtaining a detailed patient history, performing a comprehensive dermatologic examination, and considering a broad differential diagnosis based on the lesion's characteristics and the patient's overall health. This aligns with the NCCPA emphasis on the PA's role in patient assessment and management, requiring them to apply medical knowledge and clinical reasoning to diagnose and treat conditions. The process optimization here involves efficiently gathering the necessary data to arrive at the most likely diagnosis and appropriate initial management plan, which may include further diagnostic testing or referral. This methodical approach ensures that no critical information is overlooked, minimizing the risk of misdiagnosis or delayed treatment, and upholding the ethical obligation to provide competent care. An incorrect approach that relies solely on a single characteristic of the lesion, without considering the broader clinical context, is professionally unacceptable. This failure to conduct a comprehensive assessment violates the fundamental principles of patient care and the PA's responsibility to gather sufficient information for diagnosis. It could lead to a misdiagnosis of a serious underlying condition, such as melanoma, or an inappropriate treatment plan for a benign lesion. This demonstrates a lack of clinical judgment and a disregard for the systematic diagnostic process expected of PAs. Another incorrect approach that involves immediate referral without any initial assessment or consideration of the differential diagnosis is also professionally deficient. While referral is a crucial part of patient management, it should be a judicious decision based on the PA's assessment of their own expertise and the complexity of the case. Unnecessary or premature referral wastes healthcare resources and delays patient care. It suggests a lack of confidence or an abdication of the PA's diagnostic responsibilities, which are integral to their role. A third incorrect approach that involves prescribing treatment based on a presumptive diagnosis without adequate diagnostic workup or consideration of alternative diagnoses is ethically and professionally problematic. This can lead to ineffective treatment, masking of symptoms, or even adverse drug reactions. It bypasses the critical step of establishing a definitive or highly probable diagnosis, which is essential for safe and effective medical practice. The professional decision-making process for similar situations should involve a structured approach. 1. Gather comprehensive patient information, history, symptoms, risk factors. 2. Perform a thorough physical examination, focusing on the dermatologic findings. 3. Develop a differential diagnosis, listing all plausible conditions that could explain the findings. 4. Determine the most appropriate next steps, which may include further diagnostic tests, biopsy, cultures, imaging, empirical treatment, or referral to a specialist, based on the differential diagnosis and the PA's scope of practice. 5. Document the assessment and plan meticulously. Question 16. When evaluating a 68-year-old male patient presenting with exertional dyspnea and a history of poorly controlled hypertension, which of the following approaches best reflects current best practices for a physician assistant in assessing and managing his cardiovascular health? Option A. Initiate an aggressive antihypertensive regimen with a beta blocker and ACE inhibitor, assuming the dyspnea is solely due to uncontrolled hypertension, and schedule a follow-up appointment in 3 months. Option B. Prescribe a diuretic to manage the dyspnea and advise the patient to increase his physical activity without further diagnostic workup as these are common recommendations for shortness of breath. Option C. Conduct a comprehensive cardiovascular assessment including a detailed history, physical examination focusing on signs of heart failure and coronary artery disease, review of current medications for potential interactions, and order appropriate diagnostic tests such as an ECG, echocardiogram, and stress test, while consulting with the supervising physician regarding the management plan. Option D. Focus solely on optimizing the patient's current antihypertensive medication, increasing the dosage of his existing medication, and deferring further cardiac investigations until his blood pressure is at goal. The correct answer is C. Conduct a comprehensive cardiovascular assessment including a detailed history, physical examination focusing on signs of heart failure and coronary artery disease, review of current medications for potential interactions, and order appropriate diagnostic tests such as an ECG, echocardiogram, and stress test, while consulting with the supervising physician regarding the management plan. Explanation. This scenario presents a common clinical challenge for PAs, managing a patient with multiple, interconnected cardiovascular diseases. The complexity arises from the potential for drug interactions, overlapping symptoms, and the need to tailor treatment to an individual's specific risk factors and comorbidities. Careful judgment is required to prioritize interventions, ensure patient safety, and optimize therapeutic outcomes within the established scope of practice and regulatory guidelines for PAs. The correct approach represents best professional practice because it emphasizes a comprehensive, evidence-based assessment that considers the patient's entire clinical picture. This includes a thorough history, physical examination, and appropriate diagnostic testing to accurately diagnose and stratify the severity of each condition. It also involves a collaborative approach, recognizing the importance of consulting with supervising physicians and other specialists when necessary, which aligns with NCCPA emphasis on PAs practicing within their supervised framework and adhering to established medical protocols. Furthermore, it prioritizes patient education and shared decision-making, empowering the patient in their care plan, a cornerstone of ethical medical practice. An incorrect approach that focuses solely on treating hypertension without a thorough evaluation of the underlying coronary artery disease or heart failure would be a regulatory and ethical failure. This would violate the principle of providing comprehensive care and could lead to suboptimal treatment or exacerbation of other conditions. Similarly, an approach that relies on empirical treatment without adequate diagnostic workup risks misdiagnosis and inappropriate therapy, which is a failure to meet the standard of care expected of a certified PA. Another incorrect approach might involve prescribing medications without considering potential drug interactions or contraindications, which poses a direct risk to patient safety and constitutes a deviation from best practices and potentially regulatory guidelines regarding medication management. Professionals should employ a systematic decision-making process that begins with a thorough patient assessment, followed by differential diagnosis, risk stratification, and the development of an individualized, evidence-based treatment plan. This process should always include consideration of the patient's overall health status, comorbidities, and potential for drug interactions. Regular reassessment and adjustment of the treatment plan based on patient response and evolving clinical status are also critical components of effective patient management. Collaboration with supervising physicians and other healthcare providers is essential when managing complex conditions or when the PA's expertise is challenged. Question 17. The control framework reveals a 68-year-old male patient with a history of hypertension, type 2 diabetes mellitus, and osteoarthritis managed with daily NSAID presence with a 2-month history of persistent epigastric pain, heartburn, and occasional regurgitation, particularly at night. He denies any nausea, vomiting, or changes in bowel habits. His current medications include lisinopril, metformin, and ibuprofen. Which of the following pharmacological approaches would be most appropriate for this patient's presenting symptoms? Option A. Initiate a proton pump inhibitor (PPI) as standard dose. Option B. Prescribe an over-the-counter antacid for immediate relief. Option C. Administer an antiemetic medication to manage potential underlying gastrointestinal distress. Option D. Recommend a histamine 2 receptor antagonist, H2 blocker, as first-line therapy. The correct answer is A. Initiate a proton pump inhibitor, PPI, as standard dose. Explanation. This scenario presents a common clinical challenge involving a patient with multiple comorbidities and new gastrointestinal symptoms, requiring careful pharmacological management. The professional challenge lies in selecting the most appropriate medication from a class of drugs with overlapping indications but distinct mechanisms, potential side effects, and long-term implications, while considering the patient's specific health profile and potential drug interactions. Accurate assessment and selection are crucial to ensure efficacy, minimize adverse events, and adhere to evidence-based practice guidelines. The correct approach represents best professional practice because it prioritizes a thorough patient assessment, including a detailed history, physical examination, and consideration of existing conditions and medication. This systematic approach allows for the identification of the most likely cause of the patient's symptoms and the selection of a medication that is both effective and safe for this individual. Specifically, choosing a proton pump inhibitor, PPI, for persistent GERD symptoms, especially in a patient with a history of NSAID use and potential for erosive esophagitis, aligns with current clinical guidelines for moderate to severe GERD. PPIs offer superior acid suppression compared to H2 blockers and antacids, leading to more rapid symptom relief and better healing of esophageal lesions. This choice also considers the patient's age and potential for complications, favoring a medication with a robust evidence base for long-term management of GERD. Adherence to the NCCPA emphasis on evidence-based practice and patient-centered care is paramount. An incorrect approach would be to immediately prescribe an antacid for immediate symptom relief without a comprehensive evaluation. While antacids provide rapid but temporary relief, they do not address the underlying cause of persistent GERD and can mask more serious conditions. This approach fails to meet the professional standard of care by not investigating the root cause of the symptoms and could lead to delayed diagnosis and treatment of conditions like peptic ulcer disease or even malignancy. Ethically, it could be considered a failure to provide appropriate and thorough care. Another incorrect approach would be to prescribe a histamine 2 receptor antagonist, H2 blocker, as the first-line treatment for persistent, moderate to severe GERD symptoms. While H2 blockers are effective for mild GERD, they provide less potent acid suppression than PPIs and may not be sufficient for patients with significant symptoms or erosive esophagitis. This choice might be considered suboptimal and potentially a failure to utilize the most effective therapy available, especially if the patient's symptoms are indicative of more than just mild heartburn. It could also represent a failure to adhere to current evidence-based guidelines that recommend PPIs for moderate to severe GERD. A third incorrect approach would be to prescribe an antiemetic without a clear indication of nausea or vomiting. Antiemetics are designed to treat nausea and vomiting and would be ineffective for managing GERD symptoms. Prescribing such a medication would demonstrate a significant misunderstanding of the pharmacological classes and their indications, representing a failure in basic clinical knowledge and potentially leading to unnecessary medication use and patient confusion. This would be a clear deviation from professional competence and patient safety standards. The professional decision-making process for similar situations should involve a structured approach. 1. Gather comprehensive patient history, including symptom onset, duration, severity, aggravating/alleviating factors, and past medical history. 2. Perform a thorough physical examination. 3. Review current medications for potential interactions or contributions to symptoms. 4. Formulate a differential diagnosis based on the gathered information. 5. Select the most appropriate pharmacologic agent based on evidence-based guidelines, patient-specific factors, age, comorbidities, renal/hepatic function, and potential for adverse effects and drug interactions. 6. Educate the patient about the medication, its expected effects, potential side effects, and when to seek further medical attention. 7. Schedule appropriate follow-up to assess treatment efficacy and adjust as needed. Question 18. Benchmark analysis indicates that a 55-year-old male presents with epigastric pain, nausea, and vomiting, particularly after meals. He reports a burning sensation that is sometimes relieved by antacids. Considering the anatomy and physiology of the upper gastrointestinal tract, which of the following diagnostic considerations best explains this presentation? Option A. Inflammation of the distal ileum, causing malabsorption and generalized abdominal discomfort. Option B. Reduced peristalsis in the transverse colon, resulting in constipation and bloating. Option C. Obstruction of the common bile duct, leading to conjugated hyperbilirubinemia and jaundice. Option D. Impaired regulation of gastric emptying due to pyloric dysfunction, leading to increased intragastric pressure and duodenal reflux. The correct answer is D. Impaired regulation of gastric emptying due to pyloric dysfunction, leading to increased intragastric pressure and duodenal reflux. Explanation: the scenario presents a common clinical challenge for PAs, differentiating between conditions affecting similar anatomical structures within the gastrointestinal tract, requiring a nuanced understanding of their distinct physiological processes. This requires not just recall of anatomy, but also the ability to apply physiological principles to clinical presentation. The correct approach represents best professional practice because it directly links the patient's symptoms to the specific physiological dysfunction of the affected GI segment. Understanding the role of the pylorus in regulating gastric emptying and the jejunum's primary function in nutrient absorption allows for accurate differential diagnosis. This aligns with NCCPA emphasis on applying foundational medical knowledge to clinical scenarios, ensuring PAs can provide safe and effective patient care. It reflects the core competency of medical knowledge and the application of scientific concepts. An incorrect approach that focuses solely on the location of pain, without considering the underlying physiology, fails to address the root cause of the symptoms. This is a regulatory failure, as it demonstrates a lack of understanding of the physiological basis of disease, a fundamental requirement for PA practice as outlined by the NCCPA. Ethically, it could lead to misdiagnosis and inappropriate treatment, violating the principle of beneficence. Another incorrect approach that prioritizes a broad category of GI issues without specific differentiation overlooks the critical details needed for accurate diagnosis. This is a failure to meet the expected standard of care, which necessitates a precise understanding of organ-specific functions and pathologies. The NCCPA expects PAs to move beyond generalities to specific, evidence-based diagnostic reasoning. A third incorrect approach that relies on a single anatomical landmark without considering the functional implications of its involvement is also professionally unacceptable. While anatomical knowledge is crucial, its application must be integrated with physiological understanding. This approach demonstrates a superficial understanding, which is insufficient for complex clinical decision-making and falls short of the NCCPA standards for comprehensive clinical assessment. The professional decision-making process for similar situations involves a systematic approach. First, identifying the presenting symptoms and signs. Second, recalling the relevant anatomy and physiology of the involved organ systems. Third, formulating a differential diagnosis based on the interplay of anatomy and physiology. Fourth, considering diagnostic studies that will best elucidate the underlying pathology. And finally, developing a treatment plan tailored to the specific diagnosis. This iterative process, grounded in scientific principles and clinical reasoning, is essential for effective PA practice and aligns with the educational and certification standards set by the NCCPA. Question 19. System analysis indicates a 68-year-old male with a history of COPD presence to the emergency department with increased shortness of breath, wheezing, and productive cough. He reports his symptoms have worsened over the past 48 hours. His baseline oxygen saturation is typically 90% on room air. On examination, he appears dyspneic, with diffuse expiratory wheezes and scattered rhonchi. His current oxygen saturation is 86% on room air. What is the most appropriate initial management strategy? Option A. Administer high-flow nasal cannula oxygen and a diuretic. Option B. Prescribe a broad-spectrum oral antibiotic and advise the patient to rest at home. Option C. Administer supplemental oxygen to maintain saturation between 88–92%, nebulized bronchodilators, and systemic corticosteroids. Option D. Initiate mechanical ventilation immediately due to the low oxygen saturation. Correct answer is C. Administer supplemental oxygen to maintain saturation between 88–92%, nebulized bronchodilators, and systemic corticosteroids. Explanation: scenario analysis. This scenario presents a common clinical challenge involving a patient with a chronic respiratory condition experiencing an acute exacerbation. The professional challenge lies in accurately assessing the patient's current respiratory status, differentiating between common exacerbation symptoms and potential complications, and initiating appropriate management while adhering to established clinical guidelines and the NCCPA scope of practice for physician assistants. The need for timely and effective intervention is paramount to prevent further deterioration and improve patient outcomes. Correct approach analysis. The correct approach involves a comprehensive assessment that includes a detailed history of present illness, review of the patient's baseline respiratory function, and a thorough physical examination focusing on respiratory signs. This is followed by judicious use of diagnostic tools such as pulse oximetry, arterial blood gas analysis, and chest radiography to objectively evaluate oxygenation, ventilation, and identify potential underlying causes like pneumonia or pneumothorax. The subsequent initiation of evidence-based treatment, including bronchodilators, corticosteroids, and potentially antibiotics, tailored to the patient's specific presentation and guided by established protocols, represents best professional practice. This aligns with the NCCPA emphasis on the PA's role in patient assessment, diagnosis, and management within their supervisory physician's framework, ensuring patient safety and adherence to accepted medical standards. Incorrect approaches analysis. One incorrect approach would be to solely rely on the patient's subjective report of symptoms without objective assessment. This fails to meet the regulatory expectation for a thorough diagnostic workup and could lead to misdiagnosis or delayed treatment, potentially violating the standard of care and the PA's responsibility to provide evidence-based care. Another incorrect approach would be to immediately escalate care to a higher level of intervention, such as mechanical ventilation, without a systematic assessment and trial of less invasive therapies. This deviates from the principle of using the least restrictive and most appropriate interventions first, potentially leading to unnecessary patient harm and resource utilization, which is contrary to ethical practice and regulatory oversight. A third incorrect approach would be to prescribe broad-spectrum antibiotics without clear evidence of bacterial infection, such as a documented fever or purulent sputum, as this contributes to antibiotic resistance and is not supported by current guidelines for managing exacerbations of non-infectious respiratory conditions. This demonstrates a failure to adhere to evidence-based medicine and responsible antimicrobial stewardship. Professional reasoning. Professionals should approach such cases by systematically gathering information, starting with a detailed history and physical examination. This should be followed by objective data collection using appropriate diagnostic tools. Treatment decisions should be evidence-based, individualized to the patient's condition, and guided by established clinical pathways and the PA's scope of practice. Collaboration with the supervising physician is crucial, especially in complex or rapidly deteriorating cases. Continuous reassessment of the patient's response to treatment is essential to adjust the management plan as needed. Question 20. The risk matrix shows a high probability of adverse patient outcomes if cardiac assessment is incomplete. A 65-year-old male presents with sudden onset of severe substernal chest pain radiating to his left arm, diaphoresis, and shortness of breath. His vital signs are BP 100/60 mmHg, HR 110 BPM, RR 24, SpO2 92% on room air. Which of the following best reflects an implementation challenge related to the anatomy and physiology of the heart in assessing this patient? Option A. Determining the extent of valvular regurgitation or stenosis by assessing the timing and characteristics of heart murmurs, which are direct manifestations of abnormal blood flow through the cardiac valves. Option B. Identifying the specific coronary artery occlusion based on the pattern of ST segment elevation on an electrocardiogram, which correlates with the affected myocardial territory. Option C. Recognizing that the patient's elevated heart rate and decreased blood pressure are indicative of compensatory mechanisms for reduced cardiac output, reflecting the Frank-Starling mechanism. Option D. Accurately differentiating between ischemic pain due to myocardial infarction and non-ischemic causes of chest pain by understanding the innervation of the heart and surrounding structures. The correct answer is D. Accurately differentiating between ischemic pain due to myocardial infarction and non-ischemic causes of chest pain by understanding the innervation of the heart and surrounding structures. Explanation. Scenario analysis. This scenario presents a professional challenge, because it requires a PA to interpret complex anatomical and physiological information in the context of a patient's emergent presentation. The challenge lies in rapidly and accurately identifying the underlying cardiac pathology based on subtle, yet critical, physiological deviations, and then translating that understanding into appropriate diagnostic and therapeutic interventions. The risk matrix highlights potential negative outcomes, emphasizing the need for precise clinical reasoning and adherence to established protocols. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing a systematic, evidence-based assessment of the patient's cardiac anatomy and physiology. This involves correlating the patient's signs and symptoms with known pathophysiological mechanisms of cardiac dysfunction. Specifically, understanding the electrical conduction system, the mechanics of ventricular contraction and relaxation, and the interplay of valvular function is crucial for diagnosing conditions like acute myocardial infarction or significant arrhythmias. Adherence to NCCPA guidelines and established medical practice ensures that the PA acts within their scope of practice and provides care that meets the standard of a reasonably prudent physician assistant. This approach prioritizes patient safety and optimal outcomes by ensuring accurate diagnosis and timely, appropriate management. Incorrect approaches analysis. An approach that focuses solely on superficial symptoms without delving into the underlying cardiac mechanisms is professionally unacceptable. This fails to meet the standard of care because it bypasses the critical step of understanding the why behind the patient's condition, potentially leading to misdiagnosis or delayed treatment. Ethically, it represents a failure to provide competent care. An approach that relies on anecdotal evidence or unverified information from non-professional sources is also professionally unacceptable. This violates the principle of evidence-based practice, which is a cornerstone of modern healthcare and is implicitly expected by regulatory bodies like the NCCPA. It introduces a high risk of error and can lead to patient harm. An approach that delays definitive diagnosis by over-relying on non-cardiac differential diagnoses without thoroughly evaluating the cardiac system, given the presenting symptoms, is a significant regulatory and ethical failure. It demonstrates a lack of clinical judgment and a potential disregard for the urgency of cardiac emergencies, which can have severe consequences for the patient. Professional reasoning. Professionals should employ a structured approach to patient assessment, starting with a thorough history and physical examination, followed by the judicious use of diagnostic tools. When cardiac symptoms are present, a deep understanding of cardiac anatomy and physiology is paramount. This involves systematically evaluating the electrical activity, ECG, mechanical function echocardiogram, physical exam findings, and hemodynamic status, blood pressure, heart rate, perfusion. Decision-making should be guided by established clinical pathways and a constant consideration of the potential for life-threatening conditions, always prioritizing patient safety and evidence-based practice.